Hello, my name is Beck Williams, and I'll be discussing the different types of specimen collections. First, with the blood glucose monitoring collection, I will introduce myself, and then I will ask the patient for their name and date of birth, and then I will ask for their medical wristband to make sure everything aligns with the chart. And then next, I will perform hand hygiene, apply clean gloves. Assess the puncture site, and then I would make sure that it is on the lateral side of the finger. And then I would take a alcohol or antiseptic wipe and wipe the puncture site, and then I would then take a strip, plug it into the glucose meter, turn the glucose meter on, and I would then take the lancet, pierce or puncture the puncture site, take a cotton swab, remove the first drop of blood, then squeeze for the second drop of blood, get the glucose meter and touch the vial strip to the blood so that the meter can read the glucose level, and then I would dispose of my gloves, lancet, and all of that after I have received the results, and then I would remove my gloves and perform hand hygiene. Next, on the clean catch urine, I'll introduce myself to the patient, ask for their name and date of birth, medical wristband, and then I'll discuss with the patient while I'm the purpose and procedure of the collection while performing hand hygiene. And if they need help, I will help them, or ask if they need help. And if the patient cannot void at the time, or if they don't feel the urge to, then you need to make sure that they drink water half an hour before the collection, and then need to apply gloves and help if they need help with bedpan or repositioning the urinal. And then next, if they need help, you would whenever you take the lid off the cup, and set it on the counter, make sure the inside of the lid is facing up. Do not contaminate the inside of the cup. And then you with a female, you would in assisting her, you would spread the labia, take a clean towelette, wipe from front to back 3 times, left, center, right. And then with a male with a female, get her to start urinating, and during midstream, you take the cup and set it in the stream and collect 30 to 60 milliliters of urine. And with a male, you take a towelette, hold the penis, clean the penis from center to outward. And with an uncircumcised penis, you peel the foreskin back, clean from center to outward, and then get the patient to urinate. And in midstream, get the cup, collect the urine, 30 to 60 milliliters of urine, and close the container, label the container. 2 identifiers, septic source or specimen source, name and date, and all that jazz, and then label it, get it to the lab, and dispose of the gloves, perform hand hygiene. Next, on the 24-hour one, introduce myself, ask the patient for name and date of birth, medical wristband, make sure everything aligns. While I'm discussing with the patient the procedure and purpose, perform hand hygiene, make sure that the patient if possible, make sure that the patient drinks water, 2 to 4 glasses of water 30 minutes before collection, and need to make sure that if possible, make sure that and then an hour or whenever you begin testing, you need to make sure that you chart the time that you tested, and then an hour before the urination time collection ends, the patient would need to drink 2 glasses of water, and then 15 minutes before the the 15 minutes before the time ends, you need to make sure that he empties his bladder and collect all the urine and make sure that it is all labeled in the appropriate label, or make sure that it is all labeled correctly and appropriately, and if there is not, or if you have not been instructed otherwise, then you need to make sure that that the specimen bottles need to be refrigerated in a specimen refrigerator or in container of ice. And after you have contained all of the specimen, make sure that you label them all and correctly, and dispose of your gloves and perform hand hygiene. And then with a sputum collection, introduce myself, name, date of birth, and wristband. And then I would need to introduce myself, assess patient's level of understanding, like just discuss with the patient the procedure and purpose of the procedure while I am performing hand hygiene. And then I need to ask the patient, or I would need to ask the patient if they need to rinse their mouth out with water, but they can only do it water only, no toothpaste or mouthwash, because it could alter the test results. And after you have done that, you need to make sure, and you also need to make sure that you need to determine if the patient needs help, or if they can obtain the specimen on their own. And then also, after you have, once you get ready to obtain the specimen, have the patient take 3 to 4 full deep breaths with full exhalation, and then take full inhalation, followed immediately by forceful cough, making sure that the sputum exits the mouth into the container. And you must repeat until you have 5 to 10 milliliters of specimen. And then you would secure the container tightly and label it correctly. 2 identifiers, specimen name, date and time, and then remove my gloves, or get it to the lab, remove my gloves, and then perform hand hygiene. And then next, on the wound culture, I would need to, I'll introduce myself, provide or ask for their name and date of birth, and then ask for their medical wristband. And also, while I'm discussing the procedure and purpose of the collection, perform hand hygiene, and and then for the wound culture, apply gloves, ask if there any pain from 0 to 10, 10 being the worst, 0 being no pain, and determine if they need any like pain medication or anything like that. And then you need to take the wound dressing off and fold soil sides together and dispose of them in the appropriate receptacle. And then also, after you have done that, you need to make sure that you dispose of your gloves and perform hand hygiene once again, and then you would need to palpate the wound gently by rubbing from the outer edge outward, and then determine if any pain medication is necessary, and if so, 30 minutes before the dressing change. And then you would need to explain reason for wound culture, and make sure that the patient has privacy, and then you would take a swab, or before you take the swab, you would clean the area around the wound edges, and then you would take the swab, and you would rotate gently in the area of the wound, and put it in the container, and make sure, and then you would after you have put it into the container, you would crush, or before you put it into the container, you would crush the medium, but make sure you have something to protect your fingers in case you cut your fingers or something like that. But you would crush the medium, and then you would push the swab down into the bottom of the tube, and you would close the container and label it, and put it in a biohazard bag, and get it to the lab, and then remove and dispose of your gloves and perform hand hygiene. And then lastly, on the throat culture, I would come in, introduce myself. I would come in, introduce myself, ask for their name and date of birth, ask for their medical wristband, and while discussing the procedure and purpose of the collection, I will be performing hand hygiene, and then I will be determining the patient's signs and symptoms, and then I will ask the patient to sit up and face me, or sit up in the bed, or sit in a semi-Fowler's position, and then I would instruct the patient to tilt the head backward and open his mouth as wide as he could and say "ah," and that would allow me to it would allow me to visualize the pharynx, along with the tonsil area, and as the patient was saying "ah," I would take the tongue blade, press down on the tongue so that I can get more room to examine, and I would examine with a pen light, and after that I would take a swab, and I would take the swab and swab the back of the throat and the pharynx and tonsil area, making sure that I do not touch any oral structures. And after I have carefully withdrawn the swab from the mouth, making sure that I do not touch any oral structures, I insert the swab into the culture, the tube, and then I would use the gauze to protect my fingers while crushing the bottom of the tube at the medium to make sure that I don't cut my hands, and I push the swab down in there, and I would seal the tube and put it in a biohazard bag, or I would label it, put it into a biohazard bag, dispose of my gloves, and perform hand hygiene. And that is all.